Hello everyone, my name is Philip Crilly and we are at the Kingston University Clinical Skills Lab and I'm very lucky today to be joined by Barry Jabraj. Very welcome, Barry.
Thanks, Philip.
Barry is a pharmacist but also a carer for his young son Alexander, and we're going to have a question and answer session with Barry today just to find out a bit more about what is life being a carer but also being a healthcare professional. Barry, so my first question really is, how are you?
Oh, thank you. I'm all right, thank you. A bit weary. Alexander was awake at 2:30 last night. He's got Down syndrome. One of the problems is a sleep disorder, so I was up in the night with him, so a bit weary.
Bit weary. And Barry, you do work full time, or you tell us a bit about your work role.
So I'm a lecturer in pharmacy practice, and I work part time. I work 4 days a week. And then 1 day a week I care for Alexander. His morning routine and evening routine's quite complicated, so I just give Rosemary, my wife, a bit of a break and do the school run and everything.
Yes, yes. And Rosemary, your wife, I think you mentioned to me before that she's a nurse.
Yeah, she's a nurse by background, so nothing phases her, and because I'm a pharmacist, we work pretty well together to keep Alexander going.
Yeah. And that kind of leads me into a question around, do you feel that being a pharmacist and having a wife who is a nurse has helped you as a carer? Or
It does a lot. I think we just know how the system works. We just know how to access things, the right questions to ask. And I think that just makes me really wonder about people who don't know the system, for people for whom English might be a second language, who don't know how to access healthcare services.
Yes.
And we are definitely at an advantage.
Yeah. So really, as a healthcare professional, you feel that you sort of understand a bit more about Alexander's condition, whereas maybe somebody who wasn't in your position, didn't have your career, might not fully understand or appreciate that.
Yeah, they might not. I mean, one time I would say is sometimes we haven't, particularly when he was very young, take him for medical attention when we needed to. We think, he's breathing, he's fine, where actually we should have taken him. So there is a flip side to that, but I think knowing the system really helps.
Yes. So you talk about the system. Tell us about sort of who you've been involved with in terms of Alexander's care.
Sure. So Alexander has complex medical and physical needs. So he's a wheelchair user, so we use the wheelchair service. Audiology and ophthalmology, he has glasses and hearing aids. He's at a special school because he has a severe learning disability. And then all the medical stuff is paediatricians, he has asthma, thyroid problems, reflux, and the GP is centrally involved as well, and he's on a number of medicines.
And how have you found dealing with other healthcare professionals as well as pharmacists? I mean, what have these professions been like?
Yeah, I think a lot of people are brilliant, considering that the system is overstretched and we've got lots of busy clinicians and social care professionals. We've got a lot going in this country compared with other places around the world where you have nothing, and I think we need to remember how much we have in Britain. But there are times where I'd like a little bit more empathy, a little bit more curiosity from professionals, because Alexander is quite visible, and sometimes I'd like to be asked how I am, a smile, and just say, how are you getting on?
Yeah, so particularly maybe for your local pharmacist, or maybe the people who will probably view this video will be pharmacy students and pharmacists. What could they do more to make life easier or a bit better for you?
So let me give you an example. So Alexander, he's very visible, he's in a wheelchair, he makes funny noises, he does this and he does this, so you hear him coming a mile off. If we walk into any clinic, a hospital pharmacy or a community pharmacy, sometimes people say hello, sometimes they smile, sometimes they don't. That's the first thing. There was a campaign by a doctor who was dying from cancer, and she started a campaign to say, my name is. And I would encourage all of our pharmacy students and pharmacists to smile and introduce themselves. But then if you look at Alexander and you look at his prescription, and he's got tablets on there, liquids, a whole lot of things, inhalers, thickener for thickened fluids, be curious. Say, well, how do you manage to get these medicines into Alexander? I would love it if people were curious and say, how do you manage with his medicines? Because nobody has ever done that. It's not a gripe,
Yeah,
but
yeah.
it would be lovely if people said, how do you get on?
Yes,
And we've
yes.
shot a couple of videos that I think you're going to refer
Yes.
to where that's exactly done in a mocked-up consultation.
Yes, yeah, and actually the videos that you refer to are by the CPPE,
Yeah.
and those are a sort of a what good looks like type of
Yes.
consultation. Is that what you would say?
I think so. I mean, what we'll see if people do choose to look at the videos is that the pharmacist, Nina, asks me how I am, doesn't assume that I know how to get the medicines into Alexander, and it becomes very clear that I've made up my own method.
Yes.
And I think there are a lot of carers out there, not just with disabled children, but older people with Alzheimer's, older people who are struggling,
Yes.
where perhaps pharmacists assume, well, somebody else has sorted this out.
Yes.
And I suspect there are many, many thousands of carers who don't know what they're doing
Yes.
and end up doing their own thing, and it might not always be appropriate.
Yeah, yeah. In that particular video, the pharmacist asked you a question, and it was something about how I can help you or what can I do for you. Or what was that?
Yes. So it was a really lovely question because I've never been asked that before, because most of the time when I go to the community pharmacy, I just pick up the medicines.
Yes.
And I'm used to not being asked
Yes.
how I'm getting on with these, or have I had them before?
Yes.
Because very often if I've had a new medicine, I don't get asked, have I had them before? So
Yes.
I don't know how to, I know how to use them because I'm a pharmacist.
Yes, yeah.
But most people are. So because Nina said, how can I help you? Firstly, it took me aback, but secondly, I thought, right, what could I benefit from? And because I'd made up the method of giving Alexander his medicines myself,
Yes.
maybe to verify that,
Yes.
check it out.
Yes.
Is it all right? You're the pharmacist, you could check this out for me.
Yes, yeah. So even just a very simple question like, how are you getting on, or how can I help you today, prompted you to think of a few different things that actually the pharmacist could maybe help you with.
And it didn't open a can of worms.
No, yes, yes.
And it didn't take long.
Yes, yeah. And I guess maybe it's about, taking that campaign, hello, my name is, but maybe expanding it slightly to say, hello, my name is, how can I help you, or what can I do for you today?
Yes, I think that would be excellent. And I don't know whether it's fear, which is why some pharmacy students and pharmacists don't do that, and whether it's a fear of they won't be able to answer a question. I don't mind at all if they can't answer the question. You don't have to know the answer to every question.
Yes.
Or if they've got patients backing up and the prescriptions are building up and the waiting time's going up, at least arrange to talk to me another time or to come in another time.
Yes.
I'd always be very happy with that.
Yes, yeah. And I'm sure any pharmacist or maybe students who work within a pharmacy might recognise that scenario where, you're working in a very busy pharmacy and you don't feel that you have the time.
Yes.
But actually, you don't have to respond to the query immediately. You can promise the person that you will look into the query, you will find out the information for them, and maybe if you take their phone number, you can call them back, or you can ask them to pop back again to answer that query for them.
Absolutely.
Yeah.
I really don't think it's hard. However, I do recognise that hospital pharmacies, community pharmacies are very, very busy places.
Yes, yes.
The resources of staffing and time are at a premium.
Yes.
But we need you, with my carer hat on.
Yes.
There is an army of carers out there who are tired. So I was up since 2:30 this morning. We are trying to do our best. You feel so responsible as a carer, and every little bit helps.
Yes,
when you have a smile and somebody who is willing to do something for us.
Yes, yes. So somebody just appearing to show an interest in you and going above and beyond for you to make sure that life is a little bit easier for you in whatever way they can.
And what I'd like to do is, if I might be so bold, is to say that the above and beyond, I'd like to see that become the normal.
Yes.
So I'm thinking of the Royal Pharmaceuticals 4 Principles of Medicines Optimisation, and for your students, I'd really encourage them to look at that on the RPS website and download it and know what the principles are. Principle 1 is about understanding the patient experience. If you do what I need, you will do that. You'll know what it's like to be tired and to manage medicines in a child with a swallowing difficulty and a learning disability.
Yeah.
And Principle 4 is about embedding it in routine practice.
Yes.
So if you do that with all of your vulnerable patients and your vulnerable carers, you'll get used to it and it'll become second nature.
So it's about us putting ourselves into the shoes of the people who are the carers and trying to see life from their perspective.
Yes.
And to think about how we as pharmacists can do something small to make life a bit easier for those people.
Yeah, and that's empathy.
Yes, yes.
And you kind of think of the tradition of pharmacy practice when perhaps not known as an empathic profession.
Yes, yes.
You don't have to you know, become a counsellor.
No, yeah.
But
yeah.
I think it's about the human side. It's who you are,
Yes.
as well as what you do. And I think I'd encourage all the pharmacists and the students thinking about this in terms of, do I care about my patients?
Yes, yeah.
Do I care about other human beings?
Yes.
And I think that's a real challenge for all of us.
Yeah, yeah. I guess a lot of pharmacists maybe feel of themselves as being medicine experts, but actually
Yes.
there's more to the role now. We're more heavily involved in the delivery of services and
Yeah, and somebody, a professor I know of psychology as applied to medicine, he said this, which I thought very, very useful. He said, a Rolls Royce is a brilliant car, but it has no value if it's parked in a garage.
Yes.
In the same way, the Rolls Royce is our medicines expertise.
Yes.
What's the point of that expertise if we're not using it for patient benefit?
Yes, yes.
And I see a lot of pharmacists who perhaps just do a little brain dump of all the things that they know about the
Yes,
medicines,
yes.
and starting off with, right, I'm going to tell you X, Y, Z.
Yes.
I might be too tired to listen to all of that.
Yes.
So if you start off with, what would you like to know about this medicine, which is
Yes.
part of the how can I help you?
Yes.
You can tailor your medicines expertise to what the patient or the carer wants.
Yes.
Rather than, I'm a medicines expert, I'm just going to tell you what I know.
So really listening to people, listening to what their needs are, instead of just giving them all the information that you feel they need to have.
Yeah.
Really.
And I think sometimes we talk about patient-centred care, and I don't mind the term, but sometimes it becomes a bit meaningless, and people
Yes.
say, I'm going to provide patient-centred care without meaning what it is.
Yes.
And what you've described is exactly that. Let me start with you.
Yes. Yes.
And then I build and I feed in what I know
Yes.
to what you know first.
Well, there is that mantra in the NHS, no decision about me without me.
Exactly.
So we involve people in decisions about their care. And for carers as well, we involve them in decisions about the people that they care for
Yes.
too. Yeah.
And sometimes I think people worry about confidentiality. Is it all right to talk to you rather than the person? With Alexander, it's patently obvious that
Yes.
he's a minor, he's got a severe learning disability, so it's okay to talk to me.
Yes.
But I think if anybody is worried about that, a student or a practitioner, it's just to check.
Yes.
I went to visit the Down Syndrome Association a few months ago, and a lot of people with Down syndrome in a focus group that I ran, they said very often the pharmacist will just talk to their parent
Yes.
or their carer and never talk to them.
Yes. Yes.
And
yeah.
so just start the conversation with, hello, my name is, a smile, who should I be talking to here?
Yes, yes. So there are people maybe who, and obviously there are lots of people with disability who are more than capable
Yeah.
of discussing their own care.
Yes.
And maybe just to try and to find that out first, who is the person to speak
Yeah.
to about that? Yeah.
Because thinking about learning disability, it's very much on a spectrum.
Yes.
You've got mild learning disability, you've got profound learning disability, and sometimes just by looking at the patient, you can establish that. With Alexander, it's going to be clear, although please, if you ever met him in your Boots branch,
Yes.
give him a high five and he'll high five you
Yes.
back.
Yeah.
But if you just check that out, don't
Yes.
worry about not knowing, just ask the questions.
yes.
We're never offended
Yes.
by questions that you might ask.
So never be afraid to say the wrong thing,
No.
because people will understand and recognise that you're trying to be
Yeah.
helpful, you're trying to be friendly.
It's very unlikely that you'll offend people.
Yes.
If you do, it's probably because we've been awake half the night and we're just tired.
Nothing personal, it's just that,
No.
yes, yeah. And I suppose in the UK today, we have more people suffering from conditions like dementia.
Yes.
And even recently, even this week, that it was said that dementia is actually the biggest killer in the UK,
Yes.
ahead of heart disease.
Yes.
So do you feel that there are going to be bigger demands on carers in the future, or how do you feel?
Well, there's a lot. There's an organisation called Carers UK, and they do quite a lot of research and scoping out, and there are local carers networks that community pharmacists and students can come out about. The burden is getting greater.
Yes.
The key thing is that if you help carers to care, they are more likely to care for longer, and they won't burn out, because if a carer goes under, if I
Yes.
can put it crudely,
Yeah.
then that leaves the parent, the carer, the person being cared for, in stuck.
Yes.
So I think what I would say is that any help that they can have will help those army of carers, and as you say, that army is just going to get greater.
Yes, yeah. So it's really sort of looking after the carer to allow them to look after the person who they are caring for.
Exactly.
Yeah.
And I do wonder if sometimes community pharmacists underestimate what they can do.
Yes.
There is a huge amount in terms of not only prescription medicines, but over-the-counter medicines, health advice, relationship being a
Yes.
focus of care. Sometimes with Alexander, he sees so many clinicians, and it's us who keep the record of his medicines.
Yes.
And the community pharmacist can keep a record of all the over-the-counter stuff and other things.
Yes.
It's a huge contribution that community pharmacists can make.
Can play. And particularly in relation to community pharmacy, I know that you've talked in the past about a concept called My Medication Passport. Can you tell a bit us about that and how that's helped?
So for the professionals listening, the National Institute of Health Research have a number of organisations called CLARCs, which are trying to get research into practice as soon as possible. And the CLARC in North West London, whom I work for, produced a passport devised by patients for patients, which is a list of all their medicines in a passport format.
Yes.
And I piloted it in Alexander. And there was one instance where we took Alexander's list of medicines to an ear appointment, and the ENT surgeon wanted to prescribe azithromycin, a macrolide antibiotic, which interacts with the domperidone he was taking.
Yes.
Practitioners can look up what the interaction is. And the passport allows us to have a dialogue, not only about the medicines that Alexander is taking, but also about how we administer the medicines.
Yes.
And so I'm hoping that the passport will be adapted, because I think a neglected conversation item that professionals and carers and patients have is, how do you administer the medicines?
Yes, yes.
We don't do that enough.
Yes.
It should be much higher up the agenda.
Yes.
And Medication Passport can do that.
And you, as you said previously, you find that people don't ask you that question about how you administer medication.
Never.
Yeah.
And I think with you talked about the increasing army of carers, and I talk about it as an army. They are making things up. They are having to think, how am I going to make this?
Yes.
Get this patient who perhaps with dementia has got a behavioural problem, or is apathetic, or is tired, or is sleepy all the time. You know, things like they might have a sustained release tablet that they crush.
Yes.
Or they might have a liquid with somebody who's got a swallowing difficulty, and then the patient aspirates.
Yes.
And it's happening all the time.
Yeah.
And it's a neglected thing, and I'm hoping that we can really change that, because we're the only ones as pharmacists who will ask that question.
Yes.
I don't think GPs ask that.
No. And I think that's maybe what's happened. Maybe sometimes healthcare professionals assume that another healthcare professional has gone through that process, but never to assume that, and always to ask,
absolutely,
how are you getting on with this medication? How do you administer this medication?
I think that's a really good question, is ask, how do you get this in? How do you administer it? Do you have any problems with that?
Yes.
And not be afraid to say, so tell me how you do that.
Yeah, so keep the questions quite open, so that it allows the carer to sort of be clear about what it is that they actually do themselves.
Certainly.
Yeah. And I know that you have also cared for your mother in the past as well. And,
so she's gone into a care home. She has schizophrenia, she has diabetes, and cognitively she has a cognitive impairment. And one of the things that, there's two things really to mention. One is that, just like you asked earlier with my wife and I being able to know the system for Alexander, it's been enormously helpful with Mum, because the transfers of care from the community to hospital coming out again are always problematic.
Right.
There's a lot that we do to try and smooth those transitions of care, and as your listeners will hopefully know, is you've got to be very careful with medicines reconciliation, not just going into the hospital but coming out of hospital as well.
Yes, yeah.
The other thing to say is that the pharmacy technician at the community pharmacy that Mum uses, she's like gold dust. Yes. She knows when Mum's medication compliance aid is due. Yes. She knows what goes in it. She manages the repeats for us. She rings us when it's ready. Those might seem simple things. You know, did I train 5 years to just do that?
No,
Yes, you did.
Yeah.
Because it's who you are and making that difference to patients.
Yes, and I guess it's about being accountable to your patients and making sure that patients are a priority for you, and it's not just about getting prescriptions dispensed. It's about thinking about the person and thinking about how you can help them at each point.
Exactly, and making yourself accountable to patients resonates with something that I hope that pharmacy students still learn. There was guys called Hepler and Strand in the United States, and in 1990 they came up with a concept called pharmaceutical care. We've had all of these acronyms or phrases: pharmaceutical care, medicines optimization now, medicines management. And pharmaceutical care in the early 1990s was something from America which talked about making yourself responsible for your care to patients and building what they called a therapeutic relationship.
Yes.
And at the time, we kind of dismissed it. I think it's time to dust off that concept and bring it out. And I'd really encourage your listeners to go back to that paper.
Yes.
Because it's about saying, I am Barry and Alexander's pharmacist. You can come and ask me anything. You will get a hearing. You'll get my time, even if we have to book it another time.
Yes.
I know how you manage your medicines, and I will keep an eye on that for you.
Yes. Yes, so really just delving in and showing interest and being
Yeah.
curious, really.
It doesn't have to take a lot of time.
No, no,
It really
no.
doesn't.
Yeah. I mean, is there anything else within the care industry that you feel is important for pharmacists and pharmacy students to know about that maybe they don't know enough about?
I think when you're working in the community, perhaps more than in hospital, though I'd still encourage hospital pharmacists to do that, is if you know your patients, you know Barry and Alexander who come in and Alexander has Down syndrome. You know Mrs. Jones who's got dementia and the carer who's their son who lives with them. As you get to know your patients, get to know the charities that can support them.
Yes, yeah.
Get yourself invited to a local care network or carers support network. If you can go to local practice forums and make sure you're inviting agencies to come, you've got a golden opportunity here to make that part of your CPD.
Yes.
We know that continuing fitness to practice is coming. The GPHC is changing how we record CPD.
Yes.
But that's an equally valid part of your CPD as anything therapeutic or scientific, important as those things are.
Yes.
So get to know your patients and then get to know the agencies that can support them. Then what you can do is you can signpost carers
Yes.
to those agencies.
So I guess it's maybe about recognising that you won't know all of the answers, but
No.
that you do know the organisations that have more answers that
Yes.
will support patients and their carers more.
Exactly,
Yeah,
because things like the Alzheimer's Society are terrific. They've got a lot of resources there. Down Syndrome Association, they have what's called a health book.
Yes.
And I'm not saying that pharmacists should know all of these things, but it's about you develop over time as you get to know your patients.
Yes.
Just signposting people to these things.
Yes, and I guess the more you support people with different care needs, the more you're going to be able to support similar people in the future as well.
Exactly.
Yeah, and as we've talked about, this is something that we're all going to face more and more in the future, and it's to sort of help and be prepared to support carers
Exactly.
throughout our career,
Yeah.
really. Yeah. I mean, Barry, we've talked about a lot of different care needs and a lot of different conditions, and I guess for those people maybe who are watching the video who may have been affected by anything that we've talked about, or maybe are carers themselves, we will put some links to some of the different resources that you've mentioned so that people can refer to those as well.
Yeah, I think that would be great because there are likely to be carers listening to this,
Yes,
and so they can resonate it themselves, and I think it'd encourage them to get support. It's tough being a carer. It really is. You are tired, you feel responsible, you may not get a break.
Yes.
So it could be that somebody listening to this is in that situation, and yes, that support would be invaluable.
Yes, and I suppose it's just knowing that they're not the only person out there, and there are, I mean, I think I read that there were about around 8 million carers in the UK today, so there are a lot of people caring for people with illness, and it's about how we can all come together and work together to support those people.
Yes.
And the people that they care for as well.
And community pharmacy can be right at the centre of that.
Yeah, yeah. So really good opportunities for community pharmacists and for pharmacy students to really have a big impact in terms of supporting people who care for other people as well. It's an area that's been overlooked quite a lot by the pharmacy profession, but one that I'm sure Barry hopes and that I hope will be more closely looked at as we move through the future, when more and more people will require care as well.